Hello everyone, my name is Fauqia Javed and I completed my Bachelor of Optometry from NSHM Knowledge Campus, Durgapur. Currently, I am pursuing my PG Diploma in Contact Lens from Indian Academy of Optometry. Today, I am going to demonstrate the insertion and removal of the soft contact lens. So here is the procedures. So firstly, wash your hand neatly, including tip of your fingers and nails, and gently clean with the water, and do not touch the tap. Then after, dry your hands with the tissue papers or bubble-free towel. Going to next, take a contact lens sachet and try to open it from the opening side where it's instructed. Gently tear the upper part of the sachet. Then try to put out the contact lens with the help of your index finger and put it on your palm of the other hand. Try to fix the contact lens on your palm and then you dry your hands with the help of tissue. Now you can proceed for the taco test. Taco test includes two methods. First, put the lens in your palm line. Check whether the edges of the contact lens is moving inwards or not. If it's moving inwards, then it's correct. Going for the method 2, in this you have to put a contact lens on your index finger tip. The contact lens on the top of the index finger and check whether the edges of the contact lens is on complete cup shape or not. Then after, be comfortable with the contact lens and put it in your top of the index finger. You have to educate the patients to the procedures that you're gonna perform right now while insertion of the soft contact lens, that he or she is not got afraid of the procedure. Make patient completely sit comfortable to the chair and you are comfortable with the contact lens. Grasp the upper lid margin with your index finger by placing an open hand on the patient's forehead with your thumb on the temporal aspects of the patient's head. This creates support and allows the fitter to have some control of the patient's head. Put the lens on your index finger, place your thumb on the patient's cheek and grasp the lower lid margin with your middle finger. Now ask the patient to look away from the place the lens onto the temporal aspects of the eye. Avoid touching the lens or to the patient eyelashes, which would cause reflex blinking. By having the patient look away and introducing the lens from the periphery, the patient will not aware of the lens coming onto the eyes. After the lens has been placed onto the eyes, continue holding the lids apart and have the patient slowly look into the lens. The cornea will slide beneath the lens. Continue to hold the lids and have the patient slowly look about. Look for air pockets underneath the lens surface. If air pockets exist and the lids is closed quickly, the lens will buckle up and dislocate. Release the lid slowly and have a patient close the eyes. Gently massage the upper lid and force out any air pockets. Tell patients to look in all the gazes that the lens should be correctly fitted on the cornea. You can check or examine the coverage of the lens, the centration of the lens or any bubbles with the help of torchlight examination. If there is a slit lamp, you can proceed with the slit lamp too. After all this procedure, if the patient is comfortable with the fitting, he must or she must feel comfortable with the lens. Try to check the vision with the contact lens. Vision board. Repeat with the next lens. Now I am going to demonstrate the removal of the contact lens. Lens removal should be easier and quicker. Follow the same procedure as above to secure the eyelids step 1 through 5 then. Have the patient look upward. Place your index finger on the 6 o'clock position of the contact lens and slide it down slightly. This will break the surface tension between the lens and the cornea. After this, while holding the lens in place with your index finger, quickly and slightly squeeze or pinch the lens between your thumb and index finger to grab the lens from the eyes. To close the eyes and be comfortable. You are completing the process of removal of soft contact lens. Provide tissue to the patient. Before you are completed with the insertion and removal of the soft contact lens. Thank you.